This is Patrick Valera, and this is my Parkour Injury Identification, Assessment, and Prevention presentation. So, in Parkour, you have three main injuries: a wrist sprain, an ankle fracture, and an ACL tear. I'm going to go over the mechanism of injury, the anatomy and assessment, treatment, preventative and rehabilitative exercises, and then my references at the very end. So first, wrist sprain. When you have a wrist sprain, an acute wrist sprain is when the ligament is injured from an acute traumatic event or chronic repetitive movements. Now, what happens is you can slightly overstretch, you can slightly tear it, partially tear, or completely tear. This happens when, let's say, you're falling and you put your hand out in order to prevent yourself from falling. That happens the most often overuse from handstands, pushing off of walls, or swinging from bars. Perfect example, boom, fell right there on his wrist because he wanted to catch it. We have a great graphic showing the different ways that you can get injured. You have downward force from gravity, and then you have dorsal wrist impingement. Anatomy and assessment. The wrist is a collection of multiple bones and joints. It includes the distal ends of the radius and ulna, 8 carpal bones. In a wrist sprain, the ligaments that's most affected is the scapholunate ligament and the radioscapholunate ligament. An assessment: first test to see if it's swollen, red, tender, or warm to the touch. Check active and passive movement, flexion, dorsiflexion, radial deviation, ulnar deviation, functional movement like pinching or gripping small objects. Grip strength. Testing grip strength using a dynamometer is a good test for wrist sprains. A resistance test may be used to see if muscle strength is still normal. Treatment: rest the joint, ice the injured area for about 10, 15, 20 minutes, compress the injured area, elevate. You want to make sure that you keep it stable with a wrist splint, because if it's overstretched or torn, you want to make sure that it heals properly. And if you don't have a splint available, you could always make a makeshift one using a flat object that doesn't bend, such as a pencil or a ruler, and some tape. Some preventative exercises. Stretching. You want to stretch your flexors and your extensors. 3 sets. Hold for about 10 seconds each. And should be done every time before and after you train in parkour. That way you can strengthen it, you can keep it loose, you make sure that you don't really get a lot of injuries to your wrist. For a progression, you can do weighted wrist extensions. I have linked the video that I will also put in the description. You can do climb ups. This is where you are holding onto a ledge, and from hanging, you're right here, and you climb up and push yourself down, and you come back down, climb up. I wanted to do an example of it, but it's been raining here, so I was unable to. You want to do 3 sets, 10 reps, 3 times a week. Progression for that is a muscle up. Some rehabilitative exercises you can do: wrist extensions with a resistance band. It's a lot like the weighted wrist extensions, but it's a lot easier on your wrist, because the resistance band, you're just focusing on getting back that strength and your range of motion. You want to do 3 sets in both prone and supine positions, 10 reps, twice a week. Again, like I said, light resistance, regain strength, and range of motion. Once that becomes too easy, progress, and you could do push-ups after. You also want to do ulnar and radial deviation. This can be done preferably without weight. If you want to test yourself, you can use weight. 2 sets, 10 reps total, 5 each in ulnar and radial side, twice a week. Progression would be tricep extension. Again, I have a video linked there at the bottom. Next, we have ankle fractures. An ankle fracture is caused by high impact on the bone. Many different types of ankle fractures and are usually caused by a rotational injury, where the ankle becomes twisted, turned, or rolled. Mechanism of injury: falling or jumping from a high elevation and landing on the wrong feet. Anatomy and assessment. There's 3 bones that make up the ankle joint: the tibia, the talus, and the fibula. Ankle fractures are classified by the area that is broken: medial malleolus, posterior malleolus, or the lateral malleolus. The 2 joints that are involved in ankle fractures are the ankle joint and the syndesmosis joint. Assessment: look for any discoloration or breaks in the skin from displaced bones. Palpate medial and lateral malleoli and tarsal bones. Squeeze navicular and cuboid together, then proximal ends of first and fifth metatarsals, which can indicate fracture. Perform a drawer test for ankle instability. Treatment: doctor visit. See the doctor immediately. If you think that you fractured your ankle, go see your doctor. The only 100% surefire way to find out that you have a fracture, if the bone is not immediately sticking out, is through an x-ray. After the doctor diagnoses that you have a fractured ankle, they're going to put a cast and a walking boot and crutches. And in severe cases, you're going to have surgery. You're going to be in this cast and this walking boot for about 4 to 6 weeks. What you want to do before you even get to the doctor: rest and ice. Ice it and make sure you rest that ankle. Don't put any pressure. Don't put any added pressure, because you could possibly make it worse. Some preventative exercises: plantar flexion with resistance band. You can do 4 sets for each ankle, 10 reps each, 3 times a week. And a progression: do some weighted calf raises. And then another one, plantar and dorsiflexion, 4 sets each, 10-second hold. And again, another one that you do every time before you train parkour. And a good progression for that is some B-skips, which I've also linked here at the bottom. Some rehabilitative exercises: inversion and eversion towel exercise. While you're sitting, you're going to grab the towel with your toes, and you're going to start from eversion or inversion, whichever one you just decide. Just go ahead and move it to the opposite side. You're going to do 2 sets, 10 reps total, 5 reps of each side, so 5 reps inverting and 5 reps everting. You want to do that every day. That way you can get that strength and that range of motion back. And some progression: you could do single leg calf raise, preferably without weight, but if you're feeling really good, you can add some weight. And I have the video linked right there. And another thing you can do is some jump rope. You want to make sure you get that range of motion again, and also just get used to having your ankle being active. 2 sets, 45 seconds, 3 times a week. And then a progression would be a double leg Bosu ball balance. You're going to flip that Bosu ball on its side, and you're going to try to keep that range of motion within your ankle and try to get that stability back. Next, we have the ACL tear. So in an ACL tear, it's a non-contact injury. It occurs when a person generates a great amount of force or moments at the knee that apply excessive loading on the anterior cruciate ligament. And a mechanism of injury: it's incorrect landing from a jump. You want to make sure when you're landing, you land properly. Get your weight under your body. Make sure you're not landing at an awkward angle. Just make sure you're stable when you land, basically. Another mechanism of injury: pivoting the foot and rotating and stretching the knee too far. Another great image right here showing the direction of force, showing exactly where you would break that ligament. Anatomy and assessment: there are 3 bones to create the knee joint: the femur, the tibia, and patella. The collateral ligaments found on both sides of the knee are the medial and the lateral, the MCL and the LCL. The cruciate ligaments, the anterior and posterior, are found inside the knee joint, creating an X. In an ACL tear, the ligament has been split and the knee joint is now unstable. The most common physical examination is the Ligament test and pivot shift test. In the Ligament test, you want to bend the hip 45 degrees, then 90 degrees, then pull the knee forward with a sudden jerk. This tests for range of motion. And then for the pivot shift test, you want to bend the hip at 45 degrees, then bend the leg, flex, and extend the knee. This also tests for range of motion. Treatment: go see a doctor immediately. Usually when you tear an ACL, from past experiences that I have seen, I've had some teammates tear their ACLs. They said they feel a pop in their knee and they can't put any pressure on the knee. It makes them hard to get up. They need crutches to walk. They can't even bend the knee. Surgery is almost always recommended, except in rare cases where it's not a full tear. Even then, reconstructive surgery can help an athlete get back to where they were before the injury. A brace and crutches should always be used to support that injured knee, except for when you're showering and sleeping, and you're going to keep it on for about 5 to 6 weeks after surgery. Rest and rehabilitation: rest the knee with elevation. Try to keep it immobile. Rehabilitation is almost always needed. Again, after surgery, you're going to have to learn how to get that range of motion back. You're going to need the strength to come back. Rehab can help you as an athlete get back to where you were before the surgery. In recovery lasts about 6 to 9 months after the surgery. Some preventative exercises: deadlifts. You want to try to go sort of heavy, not too heavy. You want to go about 70% of your 1 rep maximum. You're going to do 4 sets, 8 reps, twice a week. And a good progression is box jumps, because you get that feeling of landing and getting that weight under your body. You don't want to put too much weight on your legs. You want to practice your landing. That way you don't tear your ACL in any way. And then another good one is some banded lunges. 3 sets, 10 reps, twice a week. And a good progression for that is a pistol squat on 1 leg. Some rehabilitative exercises is step ups and step downs. You can do 2 sets, 8 reps, 3 times a week. And a good progression is a single leg medicine ball toss. Mentally, the ACL can really affect you, so getting back into the motion of going up and down some stairs and getting that range of motion back in the knee can really help out mentally. Wall sits is another great one. 2 sets, 10 to 15 seconds, 3 times a week, and a progression for that is a banded crab walk. And here's my references. Just want to say thank you for the opportunity, and I hope you all have a great day.